Okay, good morning, everybody, and welcome. We're delighted that you're able to join us for this fifth and final webinar of the series, which is all about mutually beneficial partnerships for all. So I'm Emily Howlett, and I'm a partnership specialist at Vocal, and I'm also the programme manager for the Greater Manchester Research Engagement Network, or the GMREN. And I'm here today with my wonderful GMREN co-leads from the Applied Research Collaboration in Greater Manchester and the Caribbean African Health Network, and they'll introduce themselves later, along with a lot of brilliant guest speakers today. So just before we get started, just the usual few quick housekeeping items. So today's session is being recorded, so turn your cameras off if you prefer. Type any questions that you've got into the chat box at any time. We do have some time at the end for Q&A. Everyone's microphone should be off by default, so don't need to worry about background noise. And any resources or links or QR codes we mentioned today will all be available in the follow-up email when we'll share the slides with you as well. So if you've not been along to one of the previous webinars, then you'll enjoy this one today. And if you have been along to the previous ones, you'll know by now that this charter is more than just a document. It represents a shared commitment to building trusted, impactful and mutually beneficial relationships between researchers, research organisations, the voluntary community, faith and social enterprise sector, and with members of the public as well. And the charter is not just a static checklist. So instead, it's designed to inspire researchers to think differently about what's possible, to be truly inclusive and to ensure that everyone has access to research opportunities. And importantly, it's also about empowering the VCFSE organisations, community leaders and the public to know what to expect from research. It's about creating clarity and confidence in how we work together so these partnerships feel fair and respectful and transparent. So over the course of these 5 webinars that we've had, we've been introducing you to the key principles that VCFSEs and researchers told us were needed for equitable, meaningful and sustainable partnerships. And you've also been hearing from community voices in these webinars who have been telling you about how the Charter is already making a difference to their work and how they're embedding it into practice. So we're inviting you to sign up to the Charter, think about how it applies to you and your work to make research that works for everyone and build partnerships that are grounded in respect and trust and mutual benefit. And when our Greater Manchester Research Engagement Network website launches later on this spring, then you'll have access to all 5 webinars, along with lots of other resources, stories of change, REN events, and much, much more. So, without further ado, to hear more about Pillar 5 of the Charter, I'm going to hand over to Sue for an overview.
Good morning, everybody, and thank you so much for joining us again today. So what we're talking about today is Pillar 5. It's the final, but I think most important pillar, although these are all important, you know, that we really need to be making sure we have mutually beneficial relationships, working together in a way that rewards and values the contributions, building sustainable, mutually respectful and productive relationships. So when we're talking about true partnerships in research, we're really talking about relationships that are built on equality, where everyone's role is genuinely valued and respected. And at the heart of that is reciprocity. It's not just communities giving their time or insight. It's about making sure benefits flow both ways for communities and for researchers. Recognition plays a really big part in this. Yes, it means reimbursing people. It means making sure the VCFSE organisations are fairly rewarded and paid on time, and making sure reward and recognition are built into funding bids from the start. So we really need to be thinking about how we unleash the power of those funding bids to make sure this work is funded properly. And beyond the practical things, we also need to show real appreciation, taking the time to say thank you, acknowledging the contribution that people are making. Feedback is essential, and not just telling communities what happened as part of the project. It's about showing the difference that involvement has made. At the same time, we need to gather feedback from communities so we can keep improving how we work together and make improvements more meaningful. Sharing knowledge and skills is another part of building genuine partnerships. It's creating learning opportunities, building confidence, and supporting people to get more involved in research. And that learning goes both ways, between communities and research teams, so the impact lasts long after the research project ends. And that's what equality and respect will look like in practice. From my own experience, when I first started working for the Greater Manchester Research Engagement Network, I honestly didn't know very much about the voluntary and charity sector. I went along to some workshops, heard lots of stories and challenges. And Charles was speaking at one of these, and he talked about how organisations in the sector often struggle to find trustees, even though so many people working in healthcare research have exactly the skills that are needed to make a huge difference to organisations. And that really struck a chord with me. So I decided to take a leap into the unknown and apply for a volunteer trustee role with a charity called Homestart Host. I'm now on their board, supporting the organisation with their strategies, direction, and day-to-day advice. But to be honest, I get far more out of it than I ever expected, and that probably I give back. I've gained new networks, new insights, and a much deeper understanding of the challenges that the sector faces. And it's given me fresh inspiration that I bring back into my own role. And it's genuinely one of the most rewarding things I have ever done. So this isn't just about payments, this is about how do we create those knowledge and skills exchange that really supports the way that we work together as equal partners. I'm going to hand you over to Charles, who is going to continue the discussion with some of our panel members. Charles, over to you.
Yeah, thanks, Emily. Thanks, Sue. And I will, continue as Sue has mentioned. It has been a really fulfilling journey, and we're going to move into a discussion. But I suppose, just like you had Sue mention, we are the voluntary community-based social enterprise sector is really diverse. I mean, across Greater Manchester alone, we have over 17,000. There's a current state of the sector survey going on, but what we know is 90% or so of those have turnovers of less than 10,000. So depending on how much time you want to give, I'm sure there will be a right fit, for an organization, for yourselves. So at this point in time, I have colleagues that I'm going to welcome. We have Russ, we have John, we have Sadia, and then Asgan. So when you think of the very beginning of this project and the journey we've been on, what really helps, we're going to get into some of those discussions, but I wondered if colleagues are ready for us to get into a discussion, sort of conversation. Okay. Just wondering if the others are going to join. If not, we can start with asking. Would you mind introducing yourself? I know I forgot to introduce myself. Charles Cockwood as a Caribbean African Health Network.
Yeah, hi everyone. My name's Ashkan. I'm part of the Young People Advisory Group with ArtGM, and I'm also a research assistant.
Hi, my name is Reverend John. I am a community member. I work as an ordained priest with the Church of England in Elmstone and Davy Hume. I'm part of this community as a member of the PCIE and the Applied Research Collaboration. I've been part of REN for quite a number of years. Before I went for this, I worked with the Khan family for around 3 years, and I've been part of the community. Thank you.
Hi
Ross?
everyone, my name is Sadia. I'm also part of the Young Persons Advisory Group and I have worked as a research assistant as well. Lovely to see you all.
So, Ross, can you introduce yourself and then we get into it?
Hi, yeah, I'm Russ. I'm sorry, I'm having camera problems this morning. For some reason, it will not work. I'm a member of the patient panel at Graham Manchester Arc, and I used to be a trustee and vice chairman of a charity.
Brilliant. So, colleagues, welcome. So, over the next 20 minutes or so, there are a couple of questions and then we'll be going around the room getting reflections. So, when you think about the very beginning of this project, I'm going to get thoughts and feedback from each one. What helps you feel like a genuine partner from day one? And what sort of things makes you feel included as part of the team? So, who's going to kick us off?
Yeah, I can begin there. I personally, from my experience being part of these different research programs and as a community member, to me, I've engaged with researchers and I've seen, but what makes me to feel like that would be being involved before decisions are fixed. In such situations, when I get a research project and researchers coming and they're asking, how do we work together to have this in place and do this and get to there? So I feel part of it if the decisions are not already made and they are just telling me what they decided they are going to do. And I've enjoyed for quite a number of years people who have come and we have designed together with them. And many times we have agreed with researchers that sometimes we need to change the venues that you have thought about before. Sometimes meeting people, for example, I was speaking more for Caribbean and African populations. I said, you will meet them in churches, in mosques, in synagogues, and things like that. And researchers could change and agree, and we met in churches and we met in different places. So to me, that alone helped me to be part of it, to agree that I am part of it, because the decisions I bring, I make as part of the team are listened to, and we even change the original discussions. Yeah.
Yeah, thanks, John. I have two other colleagues who have not introduced themselves, so I'm going to bring them in and then we can move to Sadia. Yeah. So, Caroline and Sally, could you introduce yourselves, please?
Yeah, I can go first. I'm Sally. I'm a community engagement worker based in Manchester. I've been involved in a number of different health research projects as a community worker.
Thank you. Caroline, you're on mute.
Sorry, it just had a message saying I wasn't able to unmute, but anyway, fixed now. Hello, everyone. I'm Caroline Sanders. I'm Professor of Medical Sociology at University of Manchester and do a lot of community-based and participatory research, lots of research focused on addressing health inequalities broadly. And so this is a really important discussion from my point of view. I've learned lots from communities over the years and look forward to sharing a bit more on that as well. Thank you.
Thanks, Caroline. So, Sadia, did you want to come in with the... Yeah.
Yes, I think echoing a lot of what John has said, but for me, what I really, really like is knowing that I'm actually being listened to. So as a young person, unfortunately, there's loads of situations where when we speak up, people kind of nod their heads, but they're not actually taking in what we're saying. They think we're too young, that we don't have enough life experience to know what we're talking about. So I really like it when I've said something and I can see in the work that we're doing that the researcher has actually listened to what I've suggested. They've tried to understand my point of view. And I have been in research projects where we've created some really amazing things, like a theatrical piece. And every minute, I can tell you whose idea or who mentioned something to create that section of the piece. And I think that's just so wonderful. Like they have listened, they have truly respected us, regardless of our age, our background, our faith, the type of person we are, and created something that actually makes meaningful change. And for me, I don't think you can get anything better than that. To be heard is such a wonderful thing.
Thanks for sharing that, Sadia. Askin, I have another question, and feel free to chip in from the previous one. So, for you and Ross, in your experience, what does it look like when communities truly benefit from being equal partners in research? And if you have any other thoughts on what researchers need to do to make sure that happens, that would be really helpful.
Yeah. I did just have something to add on to the last one about feeling like a genuine partner. But I think when researchers or when partners actually accommodate and are flexible around people who are involved. So that might look like changing the time to have an evening meeting, or accommodating for like travel, or finances or things like that. Um, yeah, or maybe certain language barriers, just not using jargon and actually, yeah, just being flexible and actually showing your commitment to the people that are involved, that you're also willing to go a step further for them, and to make sure that they can be involved. And yeah, can I get you to repeat the second question, please?
Yeah, the second one is about your experience. From your experience, what does it look like when communities truly benefit from being equal partners in research?
Yeah, I think for the people involved that they also um, gain skills, and that might be working on new skills or building completely new ones, or having new experiences like going to conferences, um, presenting things, um, and vice versa. That's mutually beneficial for the organization or for the partners that they're working with, because they get that representation firsthand and they get experiences being told firsthand from the people that they're working with.
Thank you. Ross, do you want to come in before we go to Sally?
Yeah, I think one of the things that I've found really interesting is me being able to bring to bear in my mum's life experiences. My mum's passed away now, sadly, but I cared for her later in life. And my mum had been a person whose views had probably never have been heard. But I've had the opportunity to bring my mum's point of views into research. Like one instance I can give you is I'm working with a doctor at Salford Royal on a study called Move Smart, which is designed to get people to move every hour on the hour to make them a little bit more healthy. And I mentioned the fact that my mum used to have a trolley that she'd put a cup of tea on and wheel it through to the front room because she was too frail to carry it. And I said, could we include that in the study? That might make us able to recruit better. And the doctor said, that's a brilliant idea, Russ. I'd not considered that. That makes me feel valued. It makes me feel as though I've used my experience, not only of me, but of my mum as well. So I'm like a double-edged sword, really. So I've also got my own experience of living with multiple long-term conditions.
Ross, sorry to hear about your loss, but brilliant that there are learnings from that, but also bringing her voice, to help shape things and make the world a better place. Thanks. Sally, any thoughts from you?
Yeah, first of all, I'd like to just echo what Askan said, that I think the way that being flexible is really important when people are working or running community organisations, quite often they're very stretched, they're very busy, they've got lots of different demands going on. So I think that flexibility is really important, and also that acknowledgement of people's time being busy and that they have a lot of things that they're managing. I think as well, the point about communication. So obviously in research, there's a lot of quite complicated words, a lot of acronyms. And if you don't understand those, that can be a bit alienating. So to be able to break that down and acknowledge that people involved in community work are going to be using different language, that flexibility within communication, I think, is really important as well. And in terms of communities benefiting from research, I think it can be in a number of ways. Of course, payment for people's time is really important as a way of acknowledging both the time, but also the energy that they're putting into it, because it's a lot of energy to kind of provide your voice, especially for people that maybe that's quite a new thing for them. So I think providing payment, but also in a way that's suitable for them. So for a lot of people, that might be a cash payment rather than a voucher, because then they can use it in a way that they want to. But also maybe doing other things that can support the community. For example, upskilling members of the community. In one research project I was involved in, some participants were trained up as facilitators and then help facilitate the final research workshop. And that provided them with skills and experience that they might not have accessed elsewhere. So it's also about providing opportunities both for the participants, but also the community organisations that are involved.
Thanks, Sally. I'm going to bring in Professor Caroline, and I've added a title, but she's a real ally, and she's one of those, alongside other colleagues we've worked with in the last few years, who really value the role of the VCFE sector. And so it will be good to gain a sense of how, Caroline, from your perspective and as you work with colleagues, how can you best show the real impact communities are having on the projects you lead, and how you ensure that our time is properly costed into it. And then
Yes,
after that, we'll go to John. Yeah.
sure. I mean, I guess my views really echo, I think, what we've heard from the point of view of community members who have been contributing. As Sadia and Ashkan have talked about, feeling listened to and being heard. And I think certainly one of the things that I think is really important investment for starting out any kind of research endeavor, research project, is lots of time at the start, at the outset, to allow space for that sort of discussion, listening, ensuring that we discuss ways of working, what resources are needed from the perspectives of the communities that are are working with you as partners, so that I think in the past probably lots of people have had experiences where decisions have been made far too prematurely and things have been set out too rigidly, so that there isn't that way of understanding the sort of shared basis and equitable basis from which to start out those reciprocal relationships, understanding what's needed from both sides in terms of what the how to define shared aims for the research, but also what those perspectives are and what is needed. So I think that's really important at the time, and the resource of course comes into that. And I know John and Sally have both mentioned that really important issue, because I think, again, in the past, perhaps assumptions have been made and therefore resources may have been underestimated for a project, and also the nature of what's needed. So to recognise expertise, and I think acknowledging all of that at the very outset is so crucial. I think one of the things we've been able to do, so just a few very brief examples, from previous work that we've done working with voluntary sector organisations is, it's one of those things that where the research team, I think we've really acknowledged the expertise that comes from those communities and organisations themselves that we don't have. And therefore, what we can learn from that shared endeavour together in doing research, but also what might be needed for community researchers and that sort of what they would like in terms of upskilling or having access to resources that they might not otherwise have. And we've been able to, for example, working with some of the charities we work with, enable people to have access to the library resources, to be able to, have an honorary account, for example, to get access to things that they wouldn't necessarily have access to. Giving those communities control over the budget and payment for participants, for example, so that they can pay people according to their preference, like if people prefer cash payments in reimbursement for time, etc. So there are lots of examples, I think, but I think the crucial thing is that setting out a way of working at the beginning that is based on building really valuable, equitable, trusting relationships between partners.
Yeah, thanks, Caroline, for that. I'm going to go to John and then circle around colleagues about feedback, because obviously feedback has to be two-way. So it would be good to hear from community partners to share what's worked well and, how they can, or in the past, you've been able to feedback to research teams to make sure they improve processes. I know, John, you mentioned about venues, for example, but I'm sure as we go around the room, other colleagues could, reflect on their own journey, think about what's worked well. And I think, Sadi, earlier on, you referred to some of the skills you've acquired. So, in the interest of time, everybody will have 1 minute. So, John, kick
Yeah,
it off
just
with
a
you.
quick one. One of them, I felt valued when I participated with one of the researchers, and at the end of it, she said, "Do you mind if we take this one to another level and you co-author with me this particular paper?" And I said, "Well, that's something." She said, "Have you ever thought about it?" And from that point, we worked closely with her, and I'm always proud to say I co-authored with her that paper. And it I can't think of such a way of somebody being able as a researcher to see the time you are putting in, and also to realize sometimes the skills that you have and you are bringing with you, and you get to a level of publishing a paper in the BMC and things like that. Those are some of the points. But then, as an African, I've always told people, I've met so many researchers who have changed the mentality of Africans, that an African man doesn't reveal that I have a mental health problem. Many of them have gotten to interact with the researchers, and many of them have changed. Really, really good ways of approaching and getting to know mental health problems are realities. And they have changed, and they do go and things like that. We have seen people coming, even the young people with psychosis, bringing their friends who are going through that because they had never known it is a condition to do. So it's important in such situations that the communities benefit from interacting with the researchers, and they can own it when you take it to other levels when you are doing that kind of thing. Thank you.
Thanks. So go to Sadia, Asgan, Ross, and then Sally.
Hi again, everyone. I think some of the skills that I've gotten out of this, the first one I would say is confidence. I always thought I was a confident person, but I think everyone gets like this. I feel like I had a bit of imposter syndrome where I was like, I know I can do these things, but I'm not sure if it's gonna go well, or I'm not sure if I'm the right person for this, or I'm not sure if you want me to do this or get involved in this. And through this work, I've been able to try opportunities, I've been supported through them, and I've also been able to have conversations with people just to try and get rid of that imposter syndrome and actually get confirmation that no, my views are equally as valuable, my experiences are equally as valuable, and that just my life experiences are more than enough to create a change. I don't need a degree to do that. I don't need to have a background in science. I don't need to have titles or anything like that. Just by being me, being human, that's all I needed. So that has been amazing, and through that I've gone on to get so many more opportunities that I'm only now confident in applying for and putting my name down for because of work like this. I also have had some really cool opportunities like conferences down in London, which I'd never been to, even though I've lived in England my whole life. I've also been to Edinburgh. I've also been to Birmingham, I've been to Shrewsbury, and it's like there's just joy in knowing that not only am I exploring research as a topic, but also being able to do that with my family, my friends, my community members. I'm never alone in anything I'm doing, and it just makes it that much more precious. Not only is this work, but I'm actually creating a change for the people that I love that are around me 24/7.
Thank you. Ashkan?
Um, my point is quite similar to Sadia, but she's put it very, very eloquently. But yeah, just the experiences. I think that it's there too. I think my main thing was conferences and speaking, like publicly speaking at conferences in such a large crowd. And I've been to quite a few now, and each time I think I'm slowly bettering that skill and improving that skill. And I think that's credit to the people that I've worked with who have carried me throughout the project, not just kind of used our voices for a certain part, but actually kept us involved throughout. Because oftentimes it's the dissemination aspect that we're speaking about at conferences. Um, and yeah, so just being involved throughout and being able to carry that experience with me in different aspects.
Thank you. Ross?
Yeah, I think some of the important things are the skills are transferable. I mean, the stuff that I've learned by being a public contributor with ARC and with Health and Dementia Manchester and Vocal, I took those skills to the charity where I was a trustee, and I joined their funding board there. I looked at the people who were applying for funding for research on behalf of the charity. And I found that I could do that quite comfortably. And it was an area that the charity lacked in the people with that knowledge. So the skills are transferable as well.
Thank you. Sally? And then final words from Caroline before I hand over.
Yeah, I've learned a number of things which have helped me develop in my work as a community engagement worker. So it really helped me develop how I do outreach, because obviously there's quite standard ways to do outreach, but when I've been involved in community research, we've done it in quite different and innovative ways in spaces that I wouldn't have thought of necessarily going to, or with organisations I might not have thought to link up with. It's also just developed my skills generally in working in engaging with communities, because when it's with health research, it's a little bit different than the other type of work I've been involved in. And it's just been really great being able to provide new and different opportunities for clients or people that I've been working with. So getting people involved in research projects is great because they can have a voice and they can have opportunities like the ones I mentioned earlier where they can be upskilled. A lot of them have joined a research project and then they've ended up getting involved in lots of others. A group I worked with were taken on a visit to the university where they could be shown around the lab and different sort of research things going on at the university. And it's just really lovely to watch people's confidence grow and to watch them have these experiences where they can be empowered, especially when you're working with very marginalised communities. And then it's also helped me have a lot more of a stronger understanding of health inequalities, especially in particular areas. And that can be really helpful for the work you're doing to have that knowledge.
Thank you. Final words, Caroline?
Yeah, so very briefly, I mean, I feel that I've learned an incredible amount from people, community organizations, particularly people that I've worked with along the years. I think one of the most important things that I have learned is around supporting people when you're discussing sensitive issues. And I think because there's lots of discussion around, for example, trauma-informed research, how you create the best spaces for enabling people to be heard, where you're talking about difficult experiences. And I think I've learned an incredible amount for how people do that, but how it's rooted in a very practical sense and embedded through everyday work and practice in those community organizations. And that's just been, invaluable to have that first-hand experience and learn better ways of doing that together as researchers and communities. And I would say also similarly the importance of peer research, where you're working with community researchers and ensuring that people are supporting each other as a research team going along as well. And many of the people I've worked with have been so skilled and absolutely fantastic at enabling that, as well as other, mechanisms, practical ways of supporting inclusion, and maybe things that we as researchers hadn't really considered. So all of those things, and I'd say the value of food and sharing food together when you're in those spaces as well, and that being led by communities that you're in. I think all of those things I've certainly learned a lot from. So thank you.
Brilliant. Thanks, Caroline. Thanks, colleagues, for all your thoughts and reflections. At this point, I'm going to hand over to Rick Browning from a brilliant organization called Healthy Me, Healthy Communities, to talk about some of their work and their approach as well. So thank you. Over to you, Rick.
Thank you, and thanks to Emily and Charles for inviting me along today. And it's great to meet you all. Some people I know, and some people are very, very new. So Healthy Me, Healthy Communities. We're a CIC, a community interest company about reducing health inequalities together. Gorton Central is our home and our hub. And today I'm just going to talk through some slides which will give you a bit of insight into how we can support inclusive research, but also about how our approach sort of frames and underpins our approach to supporting research within its widest inclusive sense. So that's myself. So I'm the founder and CEO. I'm also the vice chair of Manchester Food Board and a member of the Biomedical Research Centre Governance Board. Now, I'm not just telling you those things for telling your sake. I'll explain in the slides how they really do help and support and play that part in how we can support research to make lasting change to people and communities' lives. So next slide, please. So Healthy Me, Healthy Communities, we can capture our work within the three purposes. So we're here about making a big difference to people's lives, creating lasting positive change for communities, and importantly, influencing, improving practice and policy. And it's really about how we work both on the front line, so within that engagement and involvement work, and how we can support improvements in policy and the delivery. And also that policy, how that can be successfully embedded and make a real difference to people's lives. So there's like a loop, what goes there. Next slide, please. So in terms of how that translates to our delivery, we have what we call our golden thread. So we're about connecting and collaborating. Skills and wealth, although we could call also that skills and health. And again, that important aspect is around our power in practice. So about the engagement, involvement, some elements of co-production, and how we influence and support strategy and delivery. And the next few slides are just going to give you a little bit of a taste of our work and how that sort of frames our approach of how we can support inclusive research. So our connecting and collaborate work is about connecting people within the communities they live or the communities they're part of. And the collaboration is about how we connect communities, people in communities with partners, with people with power, and how we can link those things together. Next slide, please. So our skills and wealth building, and like I say, we could really talk about health and wealth. So we all know about how poor health is a major contributor to people being in work, or when people are out of work, being able to access the benefits they're entitled to. But we also know that poor work and being out of work is a major contributor to health outcomes. And within that, something which sits in between that is the importance of mental health. And really where we sort of try to add some value is about how researchers can bring insights and lasting change around, particularly around good work and around health and work. So there we've got just a little bit of a taste of some of our delivery around the skills and wealth building work. Two aspects just to draw out there is that on site we have quite a wide range of advice and support. So when participants and researchers may bring up things through a trauma-informed approach, which may be impacting on their life, the researcher then is able to signpost successfully. So if they need some help with personal development or with debt or money, we're able to have those on site. Also, the panel have sort of mentioned around skills as well. So we deliver a number of accredited and non-accredited provision courses around community development. So people who have took part in some of the research which has took place at Gorton Central are then be able to sort of move into some more formal accredited learning, which benefits not only themselves but the community as well. Next slide, please. So our power in practice work, so sort of touched upon this a little bit, but it's about how we sort of engage and involve communities within those who hold power. We're all familiar with those who hold power, whether it be statutory bodies, universities, or people within the community themselves. So again, just a little bit of a taste here of some of the work we do. We are commissioned by Manchester City Council to deliver the Making Manchester Fairer Community Forum, which is a resident, 16 residents who were selected to give their voice, opinion, and support the Making Manchester Fairer delivery plan, which is the public health plan. And we've done some really good work around the governance with this, about how now the Making Manchester Fairer Community Forum sits alongside board, it doesn't sit below. We've got a really exciting piece of work around leaving care, around people with leaving care either now or have had past experience, and how they are, their voice, their involvement is looking at how it can improve that leaving care experience for the next generation. And really, and then we do some work around the Community Power Forum, which is a community-led piece of work. And then our health research, which I'll come into. So the next slide, please. So 2 slides now, which will just give you a bit of an insight into some of how we've been involved in research ourselves. And one of your panel, Sally Devine, has been involved in both of these, so has definitely be able to bring some frontline insights to this work. So the Cancer and Us is probably one of the sort of first formal ways we got involved in research. This was residents and researchers coming together to talk about cancer over food. so a very informal community way, and how you can develop that conversation using the power of food. And it was very much around that prevention. What does cancer prevention, what does talking about cancer mean for people in communities where they've got the greatest health inequalities? Some of the outcomes for that, some of the participants themselves, so the health literacy aspect, people who took part really did improve their knowledge and their insights into cancer for themselves and for the families. But also gain skills as well in terms of being involved within the research. And I think, as Sally mentioned, some of the people went off and did things like lab visits. Next slide, please. It's sort of then an extension. So a part of that work of working with Vocals is that, and the James Lind Alliance. We took part, we were co-applicants within a priority setting partnership, which is quite a prescribed formal way of how you start to develop future research questions which could form the basis of future research. And that's a really important aspect, because often, you know, it's great that inclusive research happens, so the research comes out into a community, follows those inclusive research principles, but then this is about actually then the community shaping what their future priorities are. And as mentioned, a big part of this was the co-facilitators. So 3 residents took part in the process from start to finish and were trained into co-facilitate. And through I think over 1,000 touch points of where local residents, health professionals, partners were able to give their insight of what they thought the health priorities were for the ward. And they were filtered down through a formal process, through a particular process, to create the top 10 research questions they would like to be asked about their community. So that takes me nicely into the next slide. And there you can see from that PSP, from that priority setting programme, is the 10 questions. And some of those which you might expect to hear from a community, and some of them not so. And I think one of the what captures that the most is number 6. How is violence and antisocial behaviour affecting the well-being of people in Gorton? And I, for one, that was quite a surprise, that and I wouldn't expect that to be there. And I'm sure the researchers are online today might not think of that as a future research question, something which can have a significant impact upon health. But the one I want to just give you just a bit of an insight to, which sort of demonstrates our approach and the value we can have to research, is number 4. So does eating food received through food banks and community grocers impact upon a person's health? One we were very pleased to see there, because we've been involved in food aid for almost 10 years. And I think one of our concerns is the high percentage of poor nutrition, hyper-processed food, which can get fast-tracked into our most poorest communities and can undermine some of the work we're all trying to do about reducing health inequalities in those communities. So that, like I say, gives us just a little bit of a taste, a little bit of a case study of our approach. So we were able to take our food aid experience of what we've been seeing, what we've been witnessing ourselves, that anecdotal experience, that through others as well was shared and included in the PSP. Through my role on the Manchester Food Board, we've been able to take some of that insights, that community voice, and it started to shape what the Manchester Food Board priorities are around food aid. And there's also shaping policy as well. It's reframing what people see as food aid as the potential solution to food poverty. And also it's been a catalyst and it's a kickstarter for some new research within the University of Manchester, who are now starting some work and being able to look at what the nutritional value of food aid is and what potential impact that has on people's lives. And that sort of leans in from a researcher's point of view of where some of the major funders like the National Institute of Health Research are saying, okay, you've got your health inequality, you've chose that, you've got your research, you're going to do inclusive research around that, then almost what's being asked is the so what. So what is the potential of that research to have on people's and communities' lives? And that's where I think we can bring some addition and some value around that for researchers. So next slide, final slide. So just a little bit of a why work with us. So I think one of the main things is, we are community based. We've got researchers within our team. We've got an experienced support team on site, so both staff and volunteers who can offer that very trauma-informed approach. Social impact built in, involving us. Will bring some social impact to your work. And also from a very practical point of view, that we offer packages. So we have one partner where we've got the space. We can purchase the food, we can handle the fees, and we can handle that both in cash and in voucher. But importantly, we can help with the recruitment of some of the people you want to reach as part of your research. And I think that just brings me to an end. I think there's one more slide on some of the partners we've worked with during the last few years on our journey around health research. And the final slide also just gives you how you can get in touch with us, and there's a link there to some of the details about our space and some of our offers. But yes, thank you very much.
Thank you, Rich. That was really, really interesting, really powerful. And I think for us sums up a question that we always get from research teams about how I've got funding for a project, I do a project, I disappear, I'm not able to maintain those connections and links to communities. So really interested, Rich and Sally, around how you kind of how research teams can move beyond that transactional, I have a project to do, to being more involved in this kind of work, and it's really, really interesting to see those support mechanisms in place. So I suppose some of it is reaching out to you and to similar organisations to work with you rather than in isolation. So I just wonder if you had any thoughts about how researchers can maintain more of a connection with the community beyond an individual project.
I suppose there's some practical ways, building within the time frame within their project, the delivery, to come back and share what they found and sort of share the insights. But I think it's sort of one of the things is that we use that as well. So we get that, as a HMHC, because then that can help shape the delivery we're going to deliver within communities. I know from a research, the process and the lag can take time, but that preliminary findings, we can start to use that. We can start to use that to shape the delivery of what we're going to deliver. But also we can start to, like I've demonstrated, we can start to take that into sort of different spaces and start to shape what delivery and policy looks like. And I think also from another practical point of view, you have spoken about it, is building in budget, that if one of your outcomes is to make a difference to communities and is to support VCFSE groups, to make sure you budget for that. And from our experience in different roles, it is an objective of most of the funders around health research to see the impact in people and communities. So I know research bids are now starting to be scored and favoured in where the researchers can clearly demonstrate that's going to happen.
Yes, thank you. Sally, I don't know whether you maybe had any other thoughts on that question.
Yeah, I think a big part is just building a strong relationship with communities from the beginning through being really clear about what it is your research is about, being really transparent and just having kind of mutual respect for each other. And I think once you build those, put a lot of work in at the beginning to build those core relationships with communities, it then creates a lot of fruition. It has like a domino effect. And also they're more likely to link you in with other groups, maybe smaller grassroots groups that they're in contact with, but it's harder for you to, for the researcher to contact. So I think a lot of that kind of that stuff at the beginning can then have a real repercussions later on and get you really embedded in a community if they feel like they trust you. Yeah, I think that's a big part of it.
Thank you both. Charles, any final words from you? We are nearly at 12 o'clock. Another session I could spend all day talking to people about. Any final words from yourself?
Yeah, no, it's been great. I mean, for colleagues who are not part of the VCFSE sector, you've heard from my colleagues. We're really keen to enhance what you do. It's great to see the funders are placing a priority on the role that lived experience brings to, research and the way it happens. But if you still need to have conversations, I'm sure some of your colleagues who have become allies, in the room that you've heard, from can have further discussions, and, we are around as well. But it makes real sense to, collaborate and to make sure we equally valued, when it comes to reimbursement and resourcing, the organizations we work with.
Thank you. So I will round up there today. This is the last of our webinars, but it is not the last of the Research Engagement Network. Hopefully these conversations have inspired you to connect with many of these really experienced people across Greater Manchester who are there to support. There are some links there to various ways to stay in contact with what's going on in different research projects. And we will have, as Emily said, our launch for our website soon, where a lot of these resources will sit. So we will join our mailing list. We keep in touch and stay in contact, and we will share thoughts and resources with you, and we look forward to continuing this work together. So thank you very much for your time today. Really appreciated, and keep in contact. We are part of a growing force to be reckoned with, to proper research engagement that's really truly inclusive. So thank you very much, everybody, and take care. Have a good day.
Thanks, everyone.
Thank you for our speakers. Thank you. Thanks, Sally. Thanks, Sadia. Russ, John. Thank you, everybody.